The stomach is tractioned to expose the infrapyloric region for dissection of the lymph node station 6, and the superior anterior pancreatico-duodenal vessels are observed. The stomach is divided near the pylorus by a 60 mm stapler inserted into the auxiliary trocar, and the left gastric vein may be observed. The splenic artery is also identified in its suprapancreatic position. The progression of the lymph node dissection exposes the portal vein. After completing the transection, the gastric resection is completed by division of the greater omentum near the spleen, with identification and ligation of the left gastro-omental vessels. Lymphadenectomy is then completed by dissecting the splenic artery to remove lymph node station 11. The gastrojejunal anastomosis was performed by double-layer PDS 30 suture. The anastomosis is completed by the anterior seromuscular suture.